our international midwives might find it a little bit tricky, not because we don't know how to examine the baby, but because we are unfamiliar with Australian standard of practice. So there are three things that they really focus on. The first one is the systematic examination from top to toe. Secondly is your communication skill, and the third one is that you know what they are doing in Australian standard of practice. Hello everyone, welcome back again to my channel. You are with me again, Julia. If you don't know me, I am an overseas qualified midwife that migrated to Australia through the OBA pathway, and today I'm going to talk to you about a newborn examination. Newborn examination is one of the possible stations that AHPRA might put it in the OSCE exam, and some of our international midwives might find it a little bit tricky, not because we don't know how to examine the baby, but because we are unfamiliar with Australian standard of practice. So in today's video, I'll show you how to do the newborn examination according to the Australian standard of practice. I'll go through it with you step by step, starting from consenting and all the way to the end by closing summary. So make sure that you stay until the end, and let's get into it. I signed a confidentiality agreement when I did my OSCE, and it said I agree to not disclose or discuss with any person any information related to the examination. Therefore, this series of OSCE preparation videos will be based on my midwifery practice in Australia as a registered midwife, and I cannot discuss any content or information regarding my experience in the OSCE exam. Before we start the demonstration, I'll quickly explain what the examiners expect from you in newborn examination stations. So there are three things that they really focus on. The first one is the systematic examination from top to toe. Make sure that you do it as a system. Secondly is your communication skills. So make sure that you communicate with parents, you ask for consent, and you explain to them what you are going to do, what you are doing, and tell them the result as well. Make sure that you include them in your practice. And the third one is that you know what they are doing in Australian standard of practice. You know that you need to ask for the consent form, you know about like patient-centered care, and you know about consenting. Okay? You can say, hi, my name is Julia. I'm the midwife on duty looking after you and your baby today. How is everything going? She might say, yeah, everything is okay. And then you can say, is it okay if I would like to do a top to toe check for your baby? She might say, yeah, it's okay. And then you ask her, are you having a boy or a girl? And she said, for example, she's a girl. Beautiful, congratulations. So she's over 24 hours old now, so it is the perfect timing to do the newborn examination. So I'll be checking for baby overall appearance. I'll check reflexes, red eye reflex, and also the oxygen saturation as well. If I find anything abnormal or I'm not sure about, I will let you know straight away. And in some cases, we might need to do the pediatrician referral as well, and they will come and review baby after this. Is that okay for you? Yeah, it's okay. Do you have any questions before I start? No, it's all good. And then you can start. So before we start, make sure that you review the history of baby. He reviewed the antenatal ultrasound, review the birth and neonatal history after birth as well. Make sure that you are aware if there is anything noted in there. After that, you can prepare the environment. So assume that baby are sleeping in a cot at the moment, okay? So you need to prepare the environment, so in a warm and clear area. So you can do it in a cot or you can do it under the radiant warmer as well. And you need to prepare all of the equipment that you require. You need to have the stethoscope, you need to have the red eye reflex machine, you need to have the oxygen saturation machine as well. After you get all of the equipment, and then you can also invite parents if they want to come and see, or you can also do it in front of them as well, so they can be aware of what you are checking, and you can tell them straight away of what you found. Okay, so once you're ready, you can go wash your hand and wear gloves. Okay, so I assume that I already wear gloves. Alright, I'm just gonna start by checking baby's identifiers. So we're gonna check the ID band. Baby normally have 2 ID bands on the foot, or maybe one's on the foot and one on the hands, okay? So checking the ID band, make sure the 3 identifiers, baby of ABCD, and the date of birth was yesterday, and they are the same yesterday, and UR number is 1, 2, 3, 4, 5, 6, 7, for example. They both are similar, and check with your paperwork and make sure that they are similar. So firstly, you look at the general appearance. So you start looking that baby looks active, baby moving, wiggling okay, baby look turned like a maturity, and the color looks like pink, so assume that baby looks pink. No sign of jaundice or no acrocyanosis. See if you can see any rashes. There's no rashes. Any birthmark? There's no birthmark that you can see. And after that, you can move to head and scalp. So when you check baby's head and scalp, I'm just gonna turn baby this way. So assume that this is a baby, okay? So you check for the size and shape, make sure that it looks symmetry. You feel the anterior fontanelle, you go along with the suture, and then you feel the posterior fontanelle. Okay, so the fontanelle should feel flat and not bulging. Okay, we might need to do the referral if the fontanelle is feel like bulging membrane or it feel like very small fontanelle. Also check that baby has any caput succedaneum or cephal hematoma on the head. Sometimes they have that, and this baby looks okay, so that's good. And then you check baby's eyes. So baby eyes look symmetrical on both sides. There's no discharge that you can see, so that's good. Check the sclera, see if you can see any of the conjunctival hemorrhage or jaundice. Otherwise, this one looks pink, so that's good. And then you check for the red eye reflexes as well. For example, this is the machine. Check for the red eye reflex on the left side, and then check on the other side. Okay, make sure that you can see eye reflex on both sides. Okay, because the absence of the red eye reflex can refer to something abnormality like cataract or something like that. So that needs further investigation. Then you check for baby's ears. So baby's ears on left and right, make sure that they both look symmetrical in size and shape, and the position looks okay from helix to the pinna, looks okay. And see if there is any of the preauricular pits or skin tags. No, there's no, so that looks good. And then you're moving down to nose, so check the baby nose. Nose look left and right, so left side and right side. Make sure that you can see the septum, so the left side and right side looks patent, so that's normal. And when baby breathes, there's no discharge, there's no nasal flaring as well. And after that, you're moving down to mouth. So baby's mouth, look at the baby's mouth, and the lips looks normal. And then you can put your finger a little bit inside because you already wear gloves. So check for the sucking reflex as well. If baby's sucking okay, then that's okay. Feel the upper palate as well. See if the palate is there nice and patent, so that's normal. And then you check for the teeth. Is there any neonatal teeth inside? If they are there, we need to refer to pediatrician, okay? Because that one need to be removed. And then you look at the gum. If the gum looks nice and pink, so that should be okay. If you can see epistyles, that's normal as well, like a white dot on the palate there. So that's about mouth. You check the reflex already, so that's good. We're moving down to the neck. So you need to feel for the clavicle. Make sure there's no crepitus or sign of fracture. So that's okay. And check if there's no webbing neck. Okay, so that should be fine. So no crepitus on the clavicle, so clavicle feels normal. Okay, and then you're moving to the cardiovascular system. So cardiovascular system, you need to listen for the baby's heart rate for 1 full minute, okay? Don't only do it for 15 seconds, do it for 1 full minute. For example, this is my stethoscope. So you listen for 1 full minute, so it should be over 100. So, and then you listen and make sure that you can hear the S1 and S2 clearly and no murmur that you can hear. Okay, so that should be good. After that, you also check for brachial pulse. So brachial pulse is around here of baby on both sides. So you check on there. For example, it's here. Okay, so you check that both sides are equal, and then you also check for the femoral pulse on here as well. Okay, make sure that they feel equal on both sides, and that's a cardiovascular system. Okay, and then you move to the respiratory rate. So respiratory rate, you need to count for 1 full minute. Baby can be rise and fall, rise and fall. So the normal range is 30 to 60 beats per minute. Okay. After that, if once you finish the 1 full minute, you need to see that, okay, both lungs move symmetrical, it's equal, so that's good. And then you need to listen to the lung sound as well. So we normally recommend to do 6 spots. So we do on the upper right, upper left, middle on the left, middle on the right, lower on the right side, and lower on the left side. Okay. So make sure that the sounds feel okay. No wheezing, no stridor or grunting, no work of breathing. Okay. After that, you can move to chest and abdomen. So when you check the chest, make sure that both sides look symmetrical. Check for them. There are 2 nipples on there. There's no breast tissue, but if they are there, it's okay as well because it's maternal hormone that pass on to baby. Is there any vicious milk that you can see? If there, it's also okay as well. And then you move down to the abdomen. Make sure that the size looks okay. It looks symmetry on the both sides, and the shape looks normal. Okay. And when you feel, it should feel soft. And then you check the umbilical cord. So the umbilical cord should already clamped and it should be clean and dry. And then you check on baby's arms. Okay, so when baby put the arms down, the length should be around the upper hip on both sides. So it should be the same length, same shape, and symmetrical on both sides. Okay, the range of movement should be freely. Because if something happen like Erb's palsy, there should be some abnormal with the mobility. Okay, make sure that the movement looks okay, and then you check baby's finger. You count 1, 2, 3, 4, 5. Okay, the 5 fingernails. Check for the nails, looks okay. Check if there's any wrapping, which is no, so normal. Check the other side. So 1, 2, 3, 4, 5 fingers and nails looks normal. Okay. And also you need to check for the creases as well. So baby should have like 3 creases. You know, like this one, creases on baby's hand on the other side as well. Alright, after you finish checking limbs, then we're moving down to genitalia. So in this part, we're gonna ask parents as well. So we need to ask parents, do you know if baby passed urine and meconium in the first 24 hours? If they say yes, then that's good, because we expect baby to pass at least 1 urine and 1 meconium. Okay, if it's more than that, it's okay. But if not, we need to send a pediatrician referral for them to come and review. Okay, so you make sure that baby passed urine and passed meconium. You look at the genitalia, look at the labia majora, labia minora, and clitoris are there, and it looks normal to you. Check the vagina. Is there any skin tag that you can see? If not, that's okay. If this is a male baby, you need to check for the opening of the urethra. Make sure that it's at the tippy top of the penis. It shouldn't be under, it shouldn't be upper, so just need to confirm that you check that. You need to feel the scrotum as well. When you feel the testes, you should feel that both testes are descent into the scrotum. If you can feel any hydrocele, then you need to do the pediatrician referral as well. Okay, or if one testis is not descent, then you also need to do the pediatrician referral. And then you check the anus. Anus should look pattern, and if baby already passed meconium, then it's a tick. Okay, and then you're moving down to the lower limbs. So when you check the lower limbs, you need to make sure that both sides look symmetrical in shape, in length, in size. Posture looks normal, and then you look down to the feet. So 1, 2, 3, 4, 5, count again and check for the Babinski side should be a positive when baby flan out like that. And then you check for the other side, so you count 1, 2, 3, 4, 5, check for Babinski as well, baby should fan out. Okay, so that's a normal in newborn. So after you count, you need to check for any webbing as well between toes. Okay, and then you check for the hips. So when you check for hips, this baby might be hard to demonstrate how to check hips, but make sure that you know how to do the Barlow and Ortolani maneuver for checking hips for baby. So Barlow, for example, you hold on like this. This is quite tricky. So you need to flex baby's knees to the abdomen like this, and then this is Barlow. If you can hear any clicking, clunking sounds, that means something wrong. And then you check for another side for Barlow as well. So when you put this finger here and then you check like this. Okay, that's Barlow. And Ortolani you check when you do the abduction on the side and see if you can hear any clicking sounds, and on the other side as well. Okay, or that's Ortolani. Okay, and then remove baby to the back and check for baby's spine. So when you check for baby's spine, you need to use your finger and go along with the spine. Make sure that it's straight. Okay, check around the sacrum here, see if any side of spina bifida. You might be able to see the sacral dimple, but if you see the base, then they're not concerned. See any tuft of hair around here, that might be a concern. You might need to put the pediatrician referral in. Okay, and then you check for the baby. You lie baby like this, you turn baby on the side, and then you check for the legs here. So there's the creases here as well. Both sides should have the symmetrical creases, and some baby have Mongolian spot as well. You can note that as a birthmark when you check and you see that. Okay, alright, what else that we haven't checked? We check for the red eye reflex, we check for some reflex, we can check for some more reflexes as well. So Moro reflex or startle reflex, when you try to drop baby quickly and baby show you the Moro reflex. You can do the stepping reflex as well, when you put baby feet on one of the cot or one of the table and then baby try to step on that. And then you also check for palmar grab reflex. If baby grabs your finger, you already check for sucking reflex, so that's fine. And after you finish, you also need to check for the oxygen. Some people prefer to do it in the beginning. You can do it in the beginning as well, but I forget, so I'm just gonna do it now. So we need to check on the preductal. When you check for the oxygen saturation, you need to do one on the right hand because it is the preductal or pre-ductus arteriosus, and then you check on one of the foot because it is the post-ductal one. Okay, like post-ductus arteriosus. So it is gonna be something like to put on the baby's hand or wrist, and then you link it with the machine. Okay, so one on the right hand and one on either foot. So this result shouldn't be 3% different. Okay, after you finish the newborn examination, you need to tell the parents of what is your finding. For example, you turn to the parents and then you say, hey, so after I have done the head to toe check for your baby, everything is all good. There's nothing that I'm concerned about. I checked the overall appearance, everything feels normal, looks normal, and the red eye reflexes looks normal on both sides. I checked for the newborn reflexes as well, as you can see when I did it, so everything looks good. I checked the oxygen saturation on hand and foot as well, and it's all in the normal range. So I would say you have a really beautiful and healthy baby. You have any questions for me? If you found something abnormal or something that you're unsure, you can just let them know as well. For example, baby have the bilateral positional talipes, and you can give them the advice about massaging. I'll get you the paper information as well, so you can follow that. If you find anything abnormal, you can just let them know as well. And if you need the pediatrician referral, you can do it and they will come and review after. Just need to let the parents know as well. If you have some time left at the end, make sure that you talk to them about these two things as well. So first thing is about vitamin K, because in Australia we always discuss about vitamin K prophylaxis with every family. And the second thing is a safe sleeping practice. So baby should lie flat on their back in their safe space, like a cot or a bassinet, private one, and nothing should be around baby's head, like no pillow, no dolls or anything. And make sure that no loosening blanket or towels as well, so everything should be tucked in nicely for baby to be nice and warm, so it will not loosen and cover baby face and can block the breathing. Okay, and that's it about a newborn examination station. So hopefully you can learn something from this video, and I'm just gonna say it again, just keep practicing, practice and practice, and practice until you get it into your muscle memory, so you don't need to think about it anymore. At least 5 times I would say, but you can do more to get more and more of that feeling. And also remember, there are 3 things that examiner are watching and expecting to see from you. So the first thing, that you introduce yourself, you ask for consent. Second thing is you explain of what you are doing. And the third thing, that you give them a clear summary of what is the finding. Okay? If you would like some extra support, I do offer a 16-minute private session. It's gonna be one-on-one, and we can go through each station together that you want to feel more confident with and get you ready for the upcoming OSCE exam. Otherwise, let me know in the comment down below of what station you would like me to cover next. And don't forget to give me a like and subscribe to my channel as well, so you won't miss any more midwifery information in Australia. And I will see you in the next video. Bye bye for now.